Owing to barriers like cultural and societal pressure on women, socioeconomic status, financial barriers, and regional barriers associated with the lack of access to services that hinder family planning in Nigeria, the Health System Consult Limited HSCL, through the Strategic Purchasing for Family Planning Initiative, concludes its 5-year-long project which addressed family planning, newborns and child health services. This event had various health enthusiasts from the government and private sector converge in Lagos on Tuesday, the 12th of March 2024, to reflect on its achievement and future plans.
The strategic purchasing for family planning and maternal, newborn and child health services project. What is this project about? The SP for FP/MNCH, as we fondly acronymed it, is a project funded by the Bill and Melinda Gates Foundation to support capacity building for strategic purchasing at the state level, with Lagos as the primary focus, and like I mentioned, with some support to Bauchi and Yobe State.
We know that investing in family planning is a very critical investment for Nigeria to reap what is called the demographic dividend that other countries in Southeast Asia benefited from when they had a rapid spur of economic growth. We know that this approach builds more sustainability because it is embedded in the government systems in Lagos State. And we also know that in principle, this has been a program that has taken on the system as is, understanding the peculiarities of the respective states, understanding that what will be successful in Yobe State is probably different from what will be successful in Lagos State.
The project set out to increase access and uptake of family planning and MNCH services in Lagos State. It embarked on a journey to assess and understand the current and emerging status of FP/MNCH service delivery vis-a-vis platforms for strategic purchasing in the state. It also intended to facilitate the full integration of FP/MNCH services into the insurance benefit packages as a pathway to sustainable FP/MNCH financing.
We know that 70% of our population are under the age of 30, which means that we have an extraordinary large youth bulge. What this project has done has to help us as a government, as a Ministry of Health, and within the agency of the Lagos State Health Management sector, to help us identify strategic pathways through which we can gather the data that's necessary, we can build the capacity that's required, and we can apply modern science and actuarial studies to determine how to make available to our reproductive population the opportunity to achieve child spacing. I'm sure that this project is going to have significant impact in ensuring that our mothers are able to space, our children are able to grow in environments where there isn't deficiency, that we eliminate tactically reduce the number and percentage of children that are suffering from inadequate nutrition, resulting in wasting and irreversible stunting, and that in the future, through alternative health financing mechanisms other than direct budgetary allocation, that we're going to be able to bring these parameters down and ensure that our mothers have healthy pregnancies, our children are born well-nourished and have access to good nutrition, and that wasting, stunting is a thing of the past. And that is really critical to this government as we drive our human capital project into a place where we can say Lagos and Nigeria is competing with the rest of the world. And I think that we're getting there very close, very slowly, but surely, especially with this kinds of project.